As a profession, we are on the cusp of a revolution. The physician associate profession is making great strides across the country and state by state, but those changes only happen with your help and involvement.
Welcome to The PA is In, the show created by PAs for PAs, where codependency with your supervising physician is a thing of the past, optimal team practice is the future, and physician associate has taken the place of physician assistant as the professional title of choice. I'm Tracy Bingaman, and I'm obsessed with redefining what success as a PA looks like and what it feels like. Here you'll find the mindset shifts, systems, and processes I use to escape healthcare burnout and integrate my work into my life. Work-life balance is a myth, and an integrated life where you thrive professionally, not a balancing act, is the goal here. My mission is to help you to grow into a unicorn PA who loves their job, has abundant energy, time to spare, and work-optional financial freedom. The PA is in. This episode of The PA is In is brought to you by Medthusiast. They are my go-to source for hilarious, adorable medical apparel. Their items are incredible design-wise and with a level of comfort that is beyond compare. Whether you are in the market for a gift for your friends in medicine or looking for an excuse to treat yourself, there is something for everyone in any specialty or medical profession. For the latest designs from PA owner, creative genius, mom, and PICU PA Andrea, head to medthusiast.com.
I have a confession to make. Despite this show and recently being way more interested and involved in politics and policies affecting PAs at both a state and national level, I have not been that active in this area in the past. In fact, other than sporadically donating to the state and local PA Political Action Committee, up until this year, advocacy and government involvement, being aware of the legalities and new legislation coming down the pike for my state and for the entire country for PAs hasn't really been on my radar. Sure, I would open the emails with updates about Arizona, Utah, or Colorado and see that things were progressing there. I'd celebrate these little wins and I'd note that things like the removal of countersignature or phrasing of supervision and think, that's great for them, and kind of keep on keeping on. It's not that I didn't care about legislative updates per se. Honestly, I have never in my practice personally felt limited by the legislation in my state. When I completed PA school and entered the workforce as a new graduate PA working in general surgery, the idea of a supervising physician was honestly a little bit comforting. Despite all that I had learned, I still had a touch of imposter syndrome. I was handwriting admission orders, and every single line I would check and double check. Part of that was because I was brand new. Who listening to this is old enough to remember handwritten soap notes and handwriting admission orders? I'd be writing admit to med surge, care of, my general surgery attending, general surgery service, NPO after midnight. I'd be checking meds in my hand paper pocket reference drug guide. I was grateful that on my team and in my corner, I had an experienced surgeon who had done this a gazillion times before. I leaned on that resource, the teammate and that quote unquote supervision, and I thrived in that situation of collaboration. But also, I feel like part of that is that quote unquote supervision, the collaborative agreement, the inherent nature of surgery, and working truly closely side by side with one surgeon who had one PA as a new graduate. It also lent me some degree of this false sense of security. I naively thought that because I was the PA and I was being supervised by my surgeon, that I was somehow less liable for the things that we were doing or the orders that we were writing. Spoiler alert. Regardless of your degree of supervision, teamwork, and collaboration, when you sign the chart, when you write that order, you're liable. which is why things like co-signature and counter-signature requirements are holding us back from fulfilling our true potential as providers and as a profession. Which is why when the medical board has a vote in regulating what PAs are doing, it's no longer helping us to take care of patients to the best of our ability. As a profession, we are on the cusp of a revolution. The physician associate profession is making great strides across the country and state by state, but those changes only happen with your help and involvement. So I'm going to step down off my soapbox now and tell you about my very first day on the Hill. I'm not even embarrassed that it was my first Hill day and that I didn't take time as a student or a newer PA to attend, because this time when they asked, I raised my hand and I did the darn thing. So the hardest part of this, my very first Hill day, and I do mean the very hardest part, was getting out of my own head, getting out of my own way, and replying with a yes. When that email came in from my state organization requesting PAs to head to the state capitol and meet with our state senators and representatives. So the email came in. I opened it and I felt this tug. I felt like I have the time, the capacity, the mental, emotional, physical, logistical bandwidth to do this. So they said, please join the PSPA for an advocacy day at Capitol Hill in Harrisburg. I live in Pennsylvania, by the way. The point of this day will be to meet, educate, and network with House and Senate members. Is anyone else like sweating, like your armpits and your palms are a little sweaty just thinking about this day? So what I did with my avoidant type A personality inbox manager skills is I marked the email unread. Hello, avoidance, but wanting to make sure that I think about it and I see it and I feel a little bit of guilt when I see that unread email. And it reminds me to make the darn decision for or against participating. So I thought about it. I checked my schedule. I kind of figured out logistics of what would happen with the kids and what Dan would do if I went for the day. I reflected back on my recent conversations as a part of this podcast or people in general in life who have been involved in the past. They spoke with such passion about advancing our career and the legislature that affects PAs in our state. But then also, this voice in my head said, I'm just me. I didn't even pay that much attention to government in high school. Civics was simply not my forte. Give me a calculus problem, I've got it. Chemistry, I'm your gal. Biology, sign me up. But government? Ugh. Ask me how laws go from infancy to being implemented, and my mind is completely blank. Now, before you go judging the public education in rural Maine, or thinking how much of a United States governmental idiot I am, I do have a general idea of how these things work, but I've never been intimately involved in the process. Yes, I vote. Yes, I review who my legislators are and who I want to be making decisions in cases like this, but I have never gone to Capitol Hill. I had never advocated for change of any kind before. So, of course, as I'm debating whether I volunteer or not, in my mind, I'm going through all the reasons why I'm not qualified to advocate for this profession. The internal dialogue inside my mind sounded something like, I've never done it before. I wasn't good at networking with a capital N in formal official capacity. I wasn't familiar with how these things worked. The thought of going made me a little sweaty, a little shaky, and a bit nervous. Heck, I didn't even know what laws had recently passed in our state or what we are working towards next from an advocacy standpoint. I am honestly really confident behind this microphone with my computer between me and you. But step out from behind this desk and shake hands with a senator? Nah, I'm good. I'll stay right here where it's safe and comfortable. Thank you very much. All those excuses, though, about why I'm not good enough or qualified enough or I wouldn't do a good job, they're bullshit. I'm just as qualified as anyone else to show up and shake hands and share about what PAs do. I am so freaking passionate about this profession and what we could do and what we have done, but also what we could do if the regulations were a little bit different. That unknown, that self-doubt, that imposter syndrome, that negative voice inside my mind kept that email marked unread in my inbox, taunting me for far too long. In fact, I never do this, but I waited until 2 days before the deadline to RSVP before I ripped the Band-Aid off and said, count me in. I filled out that RSVP form still with a lot of questions in my mind, and away we went. So, I want to tell you a little bit about my day on the Hill, what that actually looked like. So, if you're considering doing this, it will help you to know a little bit about my experience and what to anticipate. Prepare for a long day because you have to get there, go about the day, and get home, whether that's get there and stay overnight in a hotel the night before or get there the morning of. We were meeting for a briefing and breakfast beforehand at about 7:30 a.m. So our first meetings with senators or representatives were around 9 a.m. So the capital is not, I don't live in the capital city in Pennsylvania, so I had to drive about an hour and a half to get there. So 7:30 a.m., super nervous, don't know about parking, don't know where I'm going. So I probably left the house 5:30, 5:45 because I do like to be checked in early at the airport. And the same is true when I don't know where I'm going. I just like to be early. It felt important to be on time. We also wore our white coats, which if you're considering doing a hill day, was noted by multiple people that we met with throughout the day. And I think that was really key. So my early morning alarm goes off. I'm choosing my outfit, bring my lab coat. I pack my bag with portfolio, paperwork, pens, lip gloss, and of course, snacks because you do not want to see me tired or hungry. And we're off. So I was so nervous. I forgot all the advice I give my clients that before an interview, they should try to stay calm and prepare and feel confident and remember their skills and abilities. I was both jittery and excited. Honestly, I didn't really know what to expect, but I was on edge. That was for sure. So I park in the assigned parking garage. I hustle across the street, up the steps to the hotel where breakfast is at. And I'm like, am I even in the right place? So I was overjoyed to see some familiar faces, folks that I recognized from our local health network, and even a few who had been guests on the podcast in the past. So these are people I had seen at our state conference that I knew to be in charge or on the board at our state society. So I was like, phew, okay, I'm relieved. I'm on time. I'm in the right place. And these are my people. So we sit down, we have a briefing, a welcome, a quick breakfast. I go to the bathroom. Everyone was so helpful and welcoming. But also, when you're like in high school and you walk out into the cafeteria for the first day of the school year and you have your tray and you're looking around for a place to sit and you're like, everyone else knows each other. Like, where are my friends? Where are my people? Everyone did seem to know each other a little bit better than I knew them. Like I was like the new kid on the block, but also super welcoming. And there's just that moment where you walk in and you're like, where am I going to sit? Who am I going to talk to? Like, will they like me? I think I will feel that until the end of time. I am not self-actualized enough or even confident enough to walk into that room and think like, they're lucky to have me. If you have that down and you want to do an interview and tell all the rest of us where you get your confidence, send us an email. While I'm at it, I want to shout out to the team at the Pennsylvania Society of PAs. They were so organized. They had this day scheduled to a T. We had been beforehand divided into groups with a team leader in each group. And the team leader was typically someone who had been to Hill Day before, who was experienced, who like knew the deal and could show us the ropes a little. If at all possible, they matched us up with meetings that were scheduled with our specific local senators and reps that represented our counties, district, townships, areas. So if you were a constituent, they tried to put you with the person that had been elected to your area, if possible, and if they had appropriate coverage from the people, and also that those representatives were available. So we make our way to the Capitol building. We take our like mandatory, perfunctory, I don't know exactly the word I'm looking for, but like picture on the steps. So there's like evidence, like we were here. We get through security and off we go to our first meeting. So throughout the day, my group, which was 3 of us in the morning and 2 PAs in the afternoon, together we sat with 5 different legislators with various degrees of knowledge about what PAs are and what we do. So just to give you an idea of how much information or knowledge the legislators had about PAs in general, there was one who didn't know that we could see patients, diagnose things, treat things, or prescribe medications. Now, there were other representatives who had a family member, a daughter, a close friend who was a PA, who were both excited to hear about the name change and who had just a lot more familiarity with medicine in general, credentialing, like what PAs do. There was one who had been a medical examiner in the past who had worked with PAs and had push some legislation through to allow PAs in our state to sign death certificates. So there was a wide range of people who knew a lot about and knew a lot less about what PAs are and what we do. So with the people that had more knowledge about what PAs do, we were able to dive a little bit deeper into current laws, limitations, things that were kind of holding us back from the ability to deliver great care to our patients. And so we decided to sort of start each meeting by introducing ourselves, saying a little bit about what we do as a PA and where we were from, and then asking the legislator that we were meeting with how familiar they are with PAs. So throughout the meeting, we then continued on to share some upcoming legislature we were hoping to introduce in the coming months. We weren't pushing specific bills. So this was truly like a networking, a social visit. We wanted to remind these legislators and representatives who we are and what we are capable of doing. We wanted to be front or top of mind when bills come across with telehealth, with updates to insurance reimbursements, all of these things. We wanted to just sort of remind them of who we are and what we do. So the plan ongoing, we will revisit these legislators once we have a bill that's been introduced, answer their questions, make sure they understand how the passage of these bills in support of advancing the PA profession, removing co-signature, whatever is next, how those bills will break down barriers for care for patients from their area, and to make sure people can get what they need and PAs can really serve those patients.
We interrupt this broadcast with a very important announcement. You are not making enough money. Your practice and your physician do not understand the value you are adding to their patients, and therefore, you aren't earning what you're worth. If in the past your requests for a raise have been met with one single word, no. If you're working more hours than ever and seeing more patients, but you're not making any more money and you're feeling pissed about it. If you feel like you've hit the ceiling of your income band, this guide is for you. I've compiled the 5 most costly and most common mistakes that PAs make when asking for a raise, and I've told you how to avoid them and what to do instead. Download your free guide at tracybingaman.com/mistakes.
The day kind of felt like 5 strange interviews at various locations around a building that felt sort of from the inside to be walking around one of my kids' Lego creations. It was very confusing. I think that was the hardest part of the day, was getting from place to place. Truly finding the right office, getting there at the right time. So the thing that I had been super nervous about, sitting down with the senators and representatives, shaking their hands and telling them why PAs are serving people in Pennsylvania, that was not, in fact, the hardest part. I felt super comfortable answering their questions about what PAs do on a daily basis because it's what I do, it's what my colleagues do, it's what I research and teach about here. So as I was sitting there, I was highlighting the amount of PA programs in Pennsylvania, which is 30, by the way, and the fact that we will graduate more than 1,000 PAs in the coming year. And that if our new graduate PAs would consider leaving the state, it would be because maybe for some personal reason, but also it could be that the laws were not PA and patient friendly, and that the laws were obstructing patients from getting the care from available, qualified, highly trained medical professionals like PAs. It struck me as a part of those meetings how deeply important this work is. These legislators need to understand the ability of PAs to deliver care within our state, to be able to meet the needs of patients in our communities. They are the deciding votes for upcoming changes to improve patient care, which is why days like this and volunteering to go to a Hill Day and to get involved in advocacy is so important. So even with great planning and exceptional communication about what to anticipate with Hill Day, there were still a few aspects of the day that still managed to surprise me. In case you are listening to this and you're considering attending an upcoming Hill Day, I wanted to share with you some of these things so maybe you wouldn't be surprised by them. So hopefully this will serve as something that can eliminate the surprise for you. And also know this is coming from a relative rookie. I've learned this from my one day on the Hill. So here it is. I was surprised by the amount of downtime. So we had, I think, 3 meetings in the morning and 2 after lunch. And these meetings were scheduled for anywhere from 15 to 30 minutes, depending on the representative's availability, where they were located within the Capitol. And as I said, the building was very confusing. There were lots of different wings and sections. So there was a fair amount of downtime in between meetings on paper, but not really huge chunks of time enough to sit down and write an entire podcast episode. Although I did outline this episode during one of those breaks. It also was interesting and surprising to me how casual the actual meetings were. So despite these legislators wearing suits and ties and shiny dress shoes, the reps and senators were incredibly down to earth. They were so welcoming. They were generous with their time and attention. They were asking great questions. We had some great back and forth dialogue. We were all dressed up. And I think we were a little nervous and we were wanting to hit these talking points each time we sat down in an office. And many of the legislators were so kind and interested. Their office staff or their staff that met with us, if they were unavailable, were so generous and patient and just very gracious with us. I was expecting it to be a little stuffier and a little more stressful than it was. I was simultaneously impressed and surprised by the level of working knowledge that the other Hill Day attendees had for previous bills that had been passed. So, because they had been a part of advocating for these bills and followed their journey through the legislative pipeline, they were more familiar with, more prepared, and better equipped to talk about these bills that had recently passed in support of PAs or improving the legislature for PAs where we live. It was inspiring. And honestly, I cannot wait until I've been an advocate long enough to see the fruits of our labor come to fruition and change the landscape of regulation and governing practices in our state at large. The last thing that I found to be surprising to me, as someone who considers myself to generally be an extroverted person, was how both emotionally and physically draining the day was. Not only was it just a long day logistically, but it was an entire day filled with communicating with others. It kind of felt like we had 5 back-to-back group interviews on behalf of the PA profession. So those nerves and excitement were intertwined with this experience. I also feel like, and it's my general belief, that the more that you do something, the less nervous you feel. So I would feel less nervous next time. So repetition makes people more comfortable in a situation. So I would feel less nervous next time I walked into a situation like this. I also think next time I won't be so keyed up emotionally. I'll feel more prepared and truly in these situations, just like a patient getting a procedure done for the first time, it can feel like the anticipation of the unknown is the worst, most anxiety provoking part. Once you get over that hump, you survive, you realize this situation is not going to kill you. It's not going to go terribly. It's relatively painless and even a little bit fun. And you can do it. And next time you might even enjoy it and feel a little less nervous. So once we finished our meetings, we went directly to an organized happy hour. It was attended by a mix of legislators, our physician associate groups, and our lobbyists. So at happy hour, we had drinks and dinner. This was another opportunity to network with legislators before we wrapped up for the day. I'm going to be really honest and say that this portion of the day was probably the most challenging for me. I think there's two reasons for that. One, I was getting tired. I feel like when I am around people all day long, and at this point we're going on like 10, 11 hours of around the same people, smiling, engaging in polite conversation, just on your A game, feeling like you're on. I think I was tired. Two, I love knowing what's coming. So during the day, when we had a scheduled meeting with someone, we had a printout. So they gave us a printout. It had a photo, it had general information about their district, how long they had been elected, like which party they belonged to, their involvement with committees, and a few ancillary pieces of information about their personal life and interests. But spoiler alert, at this happy hour, I don't know by sight all legislators for the entire state of Pennsylvania. So I didn't know who was who. So I kind of felt like other people did know a couple of the people. And I was like, wait, was I supposed to have like studied up and know exactly all of these legislators? Which was, by the way, a made up expectation that no one else had for me. So if you're like, listen, I'm not willing to study my state legislators, do not rule yourself out as attending a Hill Day. I just think I was like, I don't know who these people are. So I do that a lot, and it makes me feel paralyzed with fear and not competent. And like I'm not the best person for this job, even though I'm standing there in the room and I'm actually really great with people if I can get out of my own head. I feel like as I'm recording this episode, I realize I still haven't conquered this little degree of imposter syndrome, which I think we never really get over, and this negative voice inside my own head. Maybe a topic for another episode. So it's important to remember in these situations that the legislators who were at this meeting, they put those navy blue pants of their pantsuit on one leg at a time. My mom always used to say that when she had a big meeting with like an upper level executive or someone who was intimidating or maybe even a jerk, she would just say, they put their pants on one leg at a time. They are another human being too. And the way to meet these people is to talk to them like a human being. So I found these conversations to be generally less intimidating than I anticipated once I got out of my own head and took action. And we would just chat about life and our shared lived experience, and occasionally about them and what they did, about us and what we did. It was simply a get to know you chat without significant pressure. It was a lot less of a big deal than I made it out to be. The other unanticipated benefit of attending Hill Day was the networking opportunity with other PAs and PA students in my state. For more thoughts on networking and how networking is downright vital and a key element of making strategic career moves, scroll on back and listen to episode 172, Networking 101. I share about why networking is so important and how it served me in my career. So, these other people in my groups, in these meetings, at lunch and happy hour are PAs and PA students from my state. These were PAs and students from all across the great state of Pennsylvania, and they were working in all different specialties. So there were PA students ready to graduate, PA students in the middle of their education, Jackie, the PA doing bone health and osteoporosis prevention and secondary treatment, who has been on the podcast in the past, Jackie Kernigan, she was there. There were PAs in urology and pediatric psych, and I'm trying to think primary care, anesthesiology, and pre-op, and all these different areas. So these connections, spending the day alongside these others, it increased the strength of connection that I have with other people in my personal professional network. It connected me to others. So if you are thinking about making a change, thinking about moving to a different part of your state, it would be a really awesome opportunity to network with other people, to ask them where they've worked and what the experience was like for PAs at that organization. Invaluable. It's truly, truly invaluable. It reminded me also in this form of connection of the specific challenges that others were facing in their positions, and maybe rules or policies or laws that they professionally were running into that were limiting their ability to take good care of patients. I had this opportunity to sit down and chat with the PA students who had come to join us for Hill Day, and those were, even short, some of my favorite conversations of the day. I love to be able to connect with students or new grads who are still young and a little naive and downright excited about the future of medicine. There is something so special about someone who is still super excited about the prospect of working in medicine, who hasn't sort of experienced the full brunt of the reality and trauma that is working in healthcare. One of the students shared her passion and this interest she had for serving a specific subset of underserved patients in a specialty that she wants to go into. And it made me so freaking happy and excited for her. I am proud to have such exceptional students joining our ranks and becoming certified practicing PAs in the coming year. In fact, I feel like this is a good place to tell you that speaking to students is one of my very favorite things to do. Whether presenting and sharing my story of burnout or conveying specific negotiating advice, I would love to speak to students in your area. So if you have the opportunity to put me in touch with your PA program, the one you went to, the one you work near, the one that you precept students for, or the one that your classmate now teaches at, I would appreciate it so much. Send me an email, send like a group email to your contact at the program and to us and my team at themoneypa@gmail.com. We would love that personal introduction and the opportunity to speak to those students to help them protect that naive joy and excitement, to help them be excited, but also guarded against how medicine can zap that passion and what they can do to protect it. So I digress. But this opportunity to network and speak with other PAs and students, it helped me to feel more connected with other PAs in my area, in the state, and other areas. We need that community. We are hungry for that connection. It can be so easy to feel like you're in a silo or on an island in your practice, specialty, or inside of your network. That ability to connect again with others who simply get it and have a shared experience as PAs is super powerful and can infuse energy into your life and career if otherwise you're feeling a little blah. Now, if you've made it this far in this episode and hearing my regaling retelling of my first Hill Day, and you're thinking, Tracy, you cannot pay me enough to go to the state capitol and meet with legislators. Never fear, there is something that you can do to help also. There are other ways to advocate and get involved, whether making phone calls, writing emails, sending thank you letters, or doing the organizational or administrative prep in advance, or simply by donating to your state or the AAPA Political Action Committee. There are things that you can do from the couch in your jammies after hours that can support this mission and our efforts in advocacy. There are local events that you can go to without having to drive across the state to the Capitol building. These opportunities, usually you can get plugged into through your state organization. So reach out to your state organization, ask, what can I do? Do you need any back-end help? How can I help with advocacy or involvement? There may be something that is a great use of your skills that would meet a need that they have at your state organization. Make sure you are supporting your state organization with your membership dues. That team is working hard. Oftentimes, their board positions are volunteer. Very few of them are getting paid. They are tirelessly working to advocate for you so that you will have less barriers to practice medicine to the fullest of your ability in your specific state. So the next time that email comes across asking you to raise your hand, consider volunteering and getting involved. Consider raising your hand and greeting that email with a resounding yes. There you have it, my experience with my first, but what certainly won't be my last Hill Day in Pennsylvania, or maybe even a trip to the actual capital of the actual United States is in my future. Until next time, this PA is out.
Congratulations, you've just joined an awesome club. By listening to a full episode of The PA is In, you are officially on the Unicorn PA team. Welcome aboard. What most team members do is they subscribe to the podcast because that allows them to automatically get the latest episode of the show. The life of your dreams exists on the other side of taking action. Keep making small shifts and keep getting better. Your life will improve, your career will soar, and you will have the confidence you need to create your own success. I will see you in the next episode. This PA is out.